Welcome to the Case Study Series by Skilled MBA. In this session, we explore the case of Satya Pharmaceuticals, an emerging Indian company in the Ayurvedic wellness space, as it navigates the complex path toward international expansion. The case centers on strategic decision-making, balancing global opportunity with organizational readiness and regulatory risk. Satya Pharmaceuticals is an Indian SME specializing in over-the-counter Ayurvedic products. Their strength lies in traditional herbal formulations backed by centuries of practice. They gained traction during the COVID-19 pandemic by leveraging rising interest in natural immunity boosters. Satya faces four big strategic questions. 1. Should it go global? 2. If yes, where? 3. When is the right time? 4. How should it enter foreign markets? Each of these questions connects to deeper themes of readiness, regulation, and risk, especially in a sector as sensitive as traditional medicine. The path forward is full of real-world barriers. Regulatory compliance. Each market has its own standards for herbal supplements. Logistics and certification managing shipping, labeling, shelf life, and certification costs. Market receptiveness. Some cultures are more open to Ayurveda than others. Organizational readiness. Satya must assess its internal bandwidth across operations, people, and compliance. This case equips learners to evaluate international expansion strategies for SMEs, apply frameworks like CAGE and PESTLE, assess timing and entry mode, trade-offs, determine export readiness, understand how regulation and culture shape go-to-market strategies in health products. Using the CAGE analysis, we compare market distances across 4 dimensions: cultural Southeast Asia, WAS, Ayurveda familiarity, Europe, or US, WAS need for consumer education, administrative UAE, halal required EU, strict EMA guidelines, geographic Southeast Asia, proximity advantage, US, higher logistics, cost economic US and EU, high margins, SE Asia, price sensitive but scalable. Before going global, Satya must assess its preparedness, documentation and compliance. Are certifications in place? Production capacity. Can we meet quality at scale? Financial resources. Do we have enough runway? Human capital. Is the team ready for global complexity? Any missing piece could lead to costly setbacks. Let's break down 3 potential regions. Factor: Southeast Asia. Gulf countries: EU, US, political, India-friendly stable complex, economic price-sensitive premium high purchasing power, social Ayurveda, known diaspora demand, alt medicine interest, technological e-commerce, rising logistics ready, highly advanced environmental eco-focus rising, harsh climate sustainability priority. Legal moderate halal required FDA EMA strict. This analysis helps prioritize target markets. Southeast Asia, Ayurveda familiarity, logistics ease, price sensitivity, Gulf countries, diaspora trust, premium demand, halal certification, mandatory EU, US high-margin markets. Alt medicine trend, high compliance cost. Satya must balance ambition with fit. Direct export, high control, high cost. Good for mature firms, distributor partnership, lower cost, local reach. Good SME starting point, licensing low investment, low control. Risk of dilution, joint venture shared risk and knowledge, high complexity. For Satya, distributor-led exports may offer the best balance early on. First mover pros: capture, early brand equity, lock distribution channels, lead category standards. Risks: readiness gaps, high education costs, regulatory ambiguity. Late entrant pros: learn from others, enter with data, lower compliance surprises. Satya must time expansion to maximize readiness without missing opportunity. Going global means more than translation. Packaging and labeling, legal and cultural adaptation, formulation, ingredient compliance marketing, science-backed messaging versus tradition-led branding. Each market demands a custom blend of localization and consistency. Now let's explore the critical discussion questions that this case brings to the table, helping learners reflect deeply on the challenges of international expansion for SMEs in specialized sectors like Ayurveda. 1. Export readiness. Is Satya Pharmaceuticals truly prepared to enter global markets? What internal capabilities, across operations, compliance, and leadership, still need to be built before going international? This question forces us to look inward before going outward. 2. Market prioritization. Among the potential regions, such as Southeast Asia, the Gulf, or Europe, which should Satya prioritize first, and why? How does your answer change based on CAGE framework insights? This encourages an evidence-based approach to market selection. 3. Distribution strategy. Should Satya begin by building B2B distribution partnerships, or should it go directly to consumers via D2C e-commerce exports? What are the risks, control factors, and brand implications of each? Students must consider channel fit, cost structures, and customer trust. 4. Timing strategy. How can Satya balance first-mover advantages with the risk of premature expansion? What signs or indicators would help determine when the timing is right? This invites a conversation around strategic patience versus proactive risk-taking. Suggested discussion flow. 1. CAGE analysis. Prioritize between UAE, Malaysia, and Germany. 2. Internal readiness. Use checklist to find gaps. 3. Product adaptation. Apply Kotler's 5 levels of product. 4. Entry mode. Compare options and justify strategy. A structured approach helps students move from theory to real-world recommendation. Readiness is core. Going global without preparation is riskier than standing still. Match capability with opportunity. Not all attractive markets are right for you now. Success lies in execution. More than market size, it's compliance, culture, and control that shape success in global health sectors. Thank you for exploring Satya Pharmaceuticals' foray into global markets, presented by the Case Study Series by Skilled MBA. This case highlights how purpose-driven SMEs can scale internationally, not by chasing trends, but by matching market timing with internal maturity. As global interest in Ayurveda grows, Satya must take bold yet thoughtful steps, balancing regulatory rigor, cultural resonance, and resource constraints. We hope this case sharpens your strategic lens on global expansion, product localization, and export readiness in emerging health sectors.